Good morning, and this morning I'm coming to you from 1524 Lavista Drive in Decatur, Georgia, United States, and I'm here with a brief citation on thrombocythemia, otherwise called thrombocytosis. Now, thrombocythemia or thrombocytosis is an elevation in the number of platelets or thrombocytes in the blood. This thrombocythemia is further differentiated into two classes. You have primary thrombocythemia, otherwise called essential thrombocythemia. And this is indicative now of a myeloproliferative disease. And it accounts for about 3% of all the thrombocythemia, which is an elevation in the number of platelets per cubic milliliter of blood. The other class of thrombocythemia is secondary thrombocythemia, otherwise called reactive thrombocythemia. And this accounts for about, say, 88% to 97% of all the thrombocythemia. So we have now secondary thrombocythemia, otherwise called reactive thrombocythemia, and primary thrombocythemia, also called essential thrombocythemia. And this accounts for 88 to 97% of the thrombocythemia. And the primary or essential account for about, well, it will be the rest, it will be about 97%. That remaining will be about 3% there. So about 12% to 3% of all the thrombocythemia. Now, the secondary or reactive thrombocythemia is indicative of polycythemia vera. Whereas the primary or essential thrombocythemia is indicative of a myeloproliferative disease. Now, a normal platelet count is about now 150,000 to 450,000 per cubic milliliter of blood, which is also a microliter. That's normal platelet count, and it's also given by 150,000 to 450,000 multiplied by 10 to the 9 per liter. That's normal platelet count. Now, anything over, say, 750,000 per cubic milliliter of blood, which is the same as a microliter, to say 1 million. platelets per cubic milliliter of blood is a status of seriousness, and medical intervention should then start it for cases of 750,000 to 1 million platelets per milliliter of blood. So we're given that the normal is 150,000 to 450,000, and that anything over 750,000 to a million, then we have to start is serious, and then we have to have medical intervention to treat some thrombocythemia. Now, furthermore, normal platelet count and abnormal platelet count are also dependent upon, say, pediatric and adult cases. So for pediatric cases, you'll have a different count for normality. And for adult cases, you'll have a different count for normality of platelets. That also goes for the rest of hematologic disorders. And also sometimes male and female. Male and female have a different statistical count for normality and abnormality. All right, so now we said that in the secondary case we have a polycythemia vera, and in the primary case we have a myeloproliferative disease. Now, high platelet count is not always indicative of a clinical malignancy. Sometimes when you have like inflammation or infection in the body, then the body increases thrombopoietin, and that also causes an elevation in the amount of thrombocytes in the blood. Also, inflammation and infection causes an increase in the platelet count, and this is not really a case of clinical malignancy. This is normal reaction to abnormal condition in the body. These platelet count are increased to help protect the body from wounds. So a second case of platelet elevation, which is not the cause for thrombocythemia, would be a cause when automated, let's put, when we measure platelets by ATM or automated machine, and this automated machine is not able to differentiate sometimes the platelets from, say, erythrocytes and other micro components in the blood. So this automated machine counts other micro components in the blood as platelets, and therefore a false elevation occurs, which can also falsify or give an apparent case of thrombocythemia. So they have two cases, the case for the automated count for the platelets. This can be avoided by taking a peripheral blood smear. By taking a peripheral blood smear, we're able to cancel out this automated machine count, which does not differentiate certain components, certain leukemic cells, certain erythrocytes type of cell, and certain other micro components in the blood. It doesn't differentiate it from the platelets. It count all those things as platelets, and therefore what you get is a false elevation of platelets in the blood. Now, our treatment of this thrombocythemia, or thrombocytosis as we know it, is this drug you could treat it by anagrelide. That's one of the generic sort of chemical substance that is used. But my amazing 5x12 matrix, the AMZ 5x12M, in its pharmaceutical configuration, I call it now implicit pharmaceutical configuration application. So we have now the AMZ 5x12M in the implicit pharmaceutical configuration. In this sort of a latent implicit mode, I have certain form of treatment, not only for thrombocythemia or thrombocytosis, but also for other hematologic disorders, and as well as other malignancies in the body. So there we have it, a brief description of thrombocythemia or thrombocytosis, and we give the statistical count for normality, and the count when it's over 750,000 cubic milliliter to 1 million, then that's a case for medical intervention and treatment. We'll also look at the opposite of the thrombocythemia, which is thrombocytopenia. Thrombo, Thrombo. Thrombocytopenia, which is a decrease in the platelets count in the blood. Thrombocytopenia, a decrease in the platelets count in the blood. And so I guess if 150,000 to 450,000 is the normal count, then anything below 150 to 450,000 would be in the region of the thrombocytopenia region, and anything over 750,000, and that is in the treatment mode for thrombocythemia or thrombocytosis. So we see now that Anna red light. Anna is one class of drug to treat this thrombocythemia. We also mention of now the polycythemia, vera, one of the cause for the secondary or reactive thrombocythemia or thrombocytosis, and that for primary or essential thrombocythemia, what we have is a case of a proliferated disease being the cause of this primary or essential thrombocythemia or thrombocytosis. So next time we will return to expand on thrombocytopenia. We expand this morning on thrombocythemia or thrombocytosis, which is an increase or an elevation in the number of platelets in the blood per cubic milliliter of blood or microliter. And the opposite, thrombocytopenia, is a decrease in the platelets count. And we also tell you that not in all cases of this increased platelets that a cause for clinical intervention is necessary, but that in certain cases of increased elevation is a normal body reaction when there's an acid phase reaction that comes about with increased thrombopoietin to increase the number of thrombocytes to help to protect the body from wounds, infections, and inflammatory responses. So, yours truly, Dolphy Gilpin here, is sort of signing out from this brief lecture on thrombocythemia and thrombocytosis. And the next time we will be expanding on thrombocytopenia.